particularly we have communities like Jamestown, we also have Akotolante, we also have Kolegono, Sukura, and those other communities that also have a number of cases reported to those very health facilities that are placed in those communities. What the Ghana Health Service, as well as the Ministry of Health and the country office of the World Health Organization, has been telling the lot of Ghanaians and those who visit our country is that we should make sure that we practice the best of sanitation as well as hygiene, and also make sure we report suspected cases early enough to those medical facilities we have around. We should also know there's also the scare of Ebola. But talking about Ebola, is it a security concern or not? And talking about security also, we need to talk about a lot more of those infractions and those incursions being made by Boko Haram, not only in northern Nigeria, but also resulting to the use of females as suicide bombers, and in the process a lot more lives being lost. There are a lot more security issues that we also need to talk about when we come to the Northern African region, where we still have some level of instability in Libya and other sections of the continent. We have an international relations expert or commentator, if you want to talk about. He's also an analyst, and he also works with the Palestinian embassy here in Accra. We have Airbad Ibrahim. He is my guest for the morning, and now straight away I have to go to you. Now particularly let's come locally to cholera. Unlike Ebola, it's not too much of a security threat, is it?
Both of them are, because sometimes people envisage, security as, being pummeled with bombs or being strafed with bullets. The worst a bomb can do is it could kill you, number one. It could also mutilate you, but at the end of the day, you may survive. But diseases like cholera and Ebola, which provides only a 10% chance of survival, are even more of security threats than open conventional warfare or insurgencies, as we see around the world. So therefore, I'm particularly enthused by the flurry of reactions we've seen in the past 48 hours. There is an interministerial, committee that has been set up, and that comprises the Ministry of Defense, Foreign Affairs, Health, local governance and rural development, and all that. And I listened to the press releases yesterday. I think they are quite assuring that we are doing our best. But I think, Roland, we should be able to stamp our feet. We should take some tough decisions. There are 3 countries within the sub-region, which I choose to call the isosceles triangle of Ebola. They are Guinea, Sierra Leone, and Liberia, and they are to the western approaches to Ghana. I think we should be able to take drastic measures. So let's shut our borders and prevent people from traveling to those countries into our country, because we seem to be in a frenzy right now. We are a bit unfazed by the reports that are coming. So therefore, I think not until we are able to find our feet and know that we have the necessary monitoring mechanisms and then the treatment mechanisms in case there is an outbreak, we shouldn't allow people to be traveling into the country just like that.
The UN has taken this seriously, especially because it thinks that it's not only a security threat, but also a health threat, particularly in the sub-region where we've lost over 600 lives in the process because of these infections. Yes. Now, if we come to Ghana, have we taken the right steps beyond just constituting a committee made up of the various ministries that would need to look into it? I think do we have the right measures in our health facilities? And then has that also been extended to the borders? I know this is just a consummation of questions that were put
even
together.
Though Ebola has been lurking in the background for only some 4 or 5 months, it's not a new pandemic. The first strand came in DR Congo in 1976. That is how come we have the word Ebola. Ebola, incidentally, is a river in DR Congo. So therefore, that strand killed about 280 people. But the current one is more adaptive and even more macabre. It's deadlier than the other one. It kills more people. Over 700 people out of some 1,300 cases have fallen prey to the merciless, claws of this deadly disease. Therefore, I am convinced that we would be able to tackle it, but we wouldn't be able to tackle an outbreak yet. That is why I believe that we should strengthen the mechanisms we are putting in place. Let's treat this as a national security issue. This is more than a mere health issue. It's a national security issue. And we are told that out of the 42 approved entry points into the country, we can only be assured of 4 those terrestrially and those by air as well. So therefore, I think let's shut down borders. That is the first step to take. If important countries like the UK are sending pieces of information out there that perhaps if push comes to shove, they will prevent people traveling from the West African sub-region from going to Heathrow Airport or entering into their jurisdiction, then that tells you how serious this health situation is. So let's shut the borders, at least for the next 3 weeks, and then we look at how we can deal with this thing, rather than, banking our faith in our, obsolete, health, mechanisms as well as the facilities we have here. Some of our doctors, even though we are told the Sierra Leonean doctor who died recently was trained at Kolebo, this thing is a new thing to us. We don't even know how to react to it. So in the meantime, even though the World Health Organization has said that the situation is not as bad as warranting the closure of borders, but as a nation with our own idiosyncratic challenges,
we need to take those
let's
precautions.
take drastic situations. Because who is not a country? The World Health Organization is not a country. It's an umbrella UN agency that brings together various agencies. Therefore, as a country, we know so well that our arsenals will be geared towards government if we don't take the right precautions. So let's shut down the borders.
Now, we're told that 42 borders we have, 4 only ready as we have it, so to speak. If that is the case, and we have some of those porous borders, and in my course of reporting, I've been through some of those borders before. You go to Petue, near Lubo, etc. Beyond the main borders, you have various sparsely dominated trenches out there and woodlands that people tend to penetrate and make entry into the country. Then it means that we need to have the security services on those lines.
Yes, certainly. I don't think an individual will advertently leave Guinea with the intent of coming to spread
not necessarily.
Ebola.
It's just that sometimes by the mode of spread, because villages, we have villages even in countries, and we're talking about Ghana particularly, who have people who live in one village, have relatives on the next village, but the borders are even different, so to speak.
You see, the borders are a marginal demarcation. As a people, we are one and the same people. I'm sure in the border towns, you can tell your wife you are going to the Togo to buy sugar and then come back to Ghana. There are certain farmlands that abut both Ghana and Togo or Cote d'Ivoire. They are contiguous because of the borderlines and all that. So I think we should take the needed precautions because it's a precarious outbreak. And the earlier we were able to tighten the noose around these entry points, especially the illegal ones, the better. Nobody would come with an intention of spreading Ebola, just as some people do for HIV/AIDS. But the person may come in as a benign tourist or visitor to Ghana. So the earlier we were able to tackle these issues, the better. Let's quarantine people. Shut borders until we are able to understand the trajectory of this outbreak and take the right measures.
Just a few weeks ago, we had the West African Health Ministers meeting, of course, under the West African umbrella, that is ECOWAS umbrella, so to speak, because we have the West African Health Ministers conference, so to speak. Yes. If perhaps those deliberations that were undertaken were fruitful enough, perhaps we could have been seeing some fruitful replications?
No, it's quite too early. I listened to him, the Director General of WAHO, West African Health Organization, Dr. Xavier Crespin. He stated explicitly that the seed money that is needed to roll back the contagion of Ebola is at least $50 million. And then Goodluck Jonathan showed some goodwill by donating $3 million and an additional $500,000 to Sierra Leone as a country. But ever since, nothing has been said about that. So if we intend to throw aside some funds to be able to tackle this, I think, Roland, let's have a two-pronged approach. In the interim, we should have ad hoc measures to stem the spread of this virus. And that doesn't mean marshalling so much wealth and all that. We need technical expertise. We should get Western doctors to be able to explain to us how this virus, they say it doesn't have a vaccine. How do we counteract the spread of the disease? Then in the long term, we look at how we can insulate the sub-region from any future outbreaks.
More importantly, once we know the countries and we know those three, we have Guinea, Liberia, as well as Sierra Leone, and we've had some of those deaths in those countries. Yes. How do we make sure, without using the needed logistics, we still, by way of just daily living and management, able to manage spread?
I don't think isolationism and protectionism are the way to go.
Well, quarantine has always been recommended by various health experts, and indeed, the World Health Organization has always recommended that in such pandemics or epidemic situations.
It's because quarantine helps. It works. If you want to know how the cookies are crumbled, you do things according to international standards. So therefore, I think let's quarantine people. We have the Lubo, we have the Bujumbura camp here, where there are Liberians, and then there is an overflow of them sometimes. They come from their neighboring countries and all that. People come into this country by air, people come by sea and all that. So I think we should be able to consolidate our grip on this jurisdiction, whatever there needs to be done, because the priority of every government is the safety and security of the citizenry. And therefore, if there is such a deadly outbreak within the sub-region, I think we should do all in our power as a country to be able to protect the people of this nation.
Now, critically, it means that the collaboration needs to be tight. Where should Ghana be looking towards? We already have representative, or the country representative of the World Health Organization helping Ghana's own health service, but it should go beyond it.
Yeah, I think, first of all, I think yesterday the communications minister stated explicitly that they are receiving logistical and financial support from the United Nations. So it's a positive sign. But this is a pandemic. It has reached, uncontrollable proportions. And the way we are listening to overtures coming from our Western partners means that they have the commitment to help us out of this, because we live in a world of interstate and intercontinental dependency, and then people travel all across the world. So if there is a problem in one section of the world and you don't treat it holistically, then perhaps there will be domino effects into other countries. Therefore, the UK isn't taking this lightly, and I know other power brokers within the corridors of the United Nations, like the US and France, aren't taking this lightly. Mind you, the source of the outbreak, Guinea, which has suffered half of the casualties, is a francophone country. So it means that there is a certain commitment from our Western partners that we need to tackle this. But let's go beyond rhetoric, and let's be able to, let's transfer expertise. We should enlist the expertise of, people who work for Médecins Sans Frontières, people who have the experience in dealing with such pandemics, because such pandemics have broken out in war-torn areas, and they've been able to quarantine people and then prevent a potential spread. So let's do just that. The playbook is there. Ours is to pluck the relevant leaves so that we are not taken aback.
So yesterday, that's on Thursday, the press conference was convened, and so the public was addressed through the media that the Inter-Ministerial Committee was going to undertake a number of measures, and all these, they're getting those collaborations with not only the international UN agencies like the World Health Organization, Médecins Sans Frontières, and the other medical organizations, but also there's a pool of resources that is coming from various multilateral as well as donor countries just into Ghana and the rest of West Africa to make sure we get acts right. So let's just watch a playback of that very story, and then we'll ask Aribad what he thinks about those efforts put together so far.
The media briefing was to update the public not only on measures taken so far, but also to indicate further steps to ensure that Ghanaians are protected from the Ebola viral disease. The measures includes an establishment of Ebola treatment centers, intensifying surveillance at all borders, equipping health facilities with the needed resources to manage a possible outbreak. The team, which comprises the Ministers for Health, Interior, Defense, Communications and Local Government and Rural Development, is under the chairmanship of the Minister for Health, Dr. Kweku Agyemang-Mensah.
Efforts are underway to establish Ebola treatment centers in Accra, Kumasi and Tamale to cater for the southern, middle and the northern zones of the country. Going forward, we entreat all institutions to minimize mass gatherings that would necessitate the convergence of individuals from different places in the sub-region as we remain in this high alert phase. Any mass gathering, particularly if it involves people from affected communities moving across borders, to attend such conferences in the country poses a serious security threat. Government will continue to work towards the best case scenario, which is prevention of the Ebola virus disease.
Head of the Disease Surveillance Department of the Ghana Health Service, Dr. Bedusa Akodie stressed adequate logistics have been secured at health facilities to combat an outbreak.
By the end of the week, at least 3 designated facilities which shall be cover the southern zone, the middle zone, and the northern zone, and based at Accra area, and then Kumasi and Tamale will be ready for us specifically to use for Ebola. We have managed about 24 suspected cases, and these cases have tested negative. These cases were not managed in the midst of other conditions. We provided some form of isolation whilst we manage these cases within the health sector to make sure that we don't contaminate ourselves, we don't transmit the person or the disease from one person to another, and also not to contaminate the environment. My office has distributed PPEs to the area people that are likely to come in contact with suspected cases, the staff that are likely to come in contact with suspected cases, and the frontline staff at the various points of entry. All the teaching hospitals, the regional hospitals have PPEs. We have sent PPEs to the airports and all the points of entry.
World Health Organization's country representative, Dr. Magda Rubalu, emphasizing WHO's commitment to supporting the sub-region, called for a more intensified public education.
The most important tool that we need to give to people is information, is educate them on what the disease looks like and what do they need to do if they are not well. We have provided education materials, and we are working with the international community to mobilize additional resources should they be needed to complement what the government of Ghana is already providing.
Matilda helping us with that very compiled report there. Your impressions about those efforts so far?
They are good. They are quite assuring. But normally they say the proof of the pudding is in the eating. It's easier said than done. But when you look at the posturing of our leaders, it tells you how seriously they've taken this outbreak. So I'm quite optimistic and sanguine that we'll be able to insulate this country. But we shouldn't be complacent. I've heard, talks that Ghana is well prepared, when in fact yesterday reports were awash in the media that cholera patients were being treated in uncompleted buildings at Amasaman. So our level of preparedness, I think, is very low. So therefore, the best we can do is take the necessary preventive measures. I don't think we have the curative acumen to tackle this thing. So let's prevent it from making inroads within this country. And let's treat this as a national security issue. Let's take it as though a hostile army is lurking across our borders, ready to invade. Let's do our best to fend off and stave off such a security threat.